Hi everyone, today's lecture is on diseases of the bones and the joints. So for diseases of the bones, we will be looking at osteoporosis, whereas for diseases of the joints, we will be looking at three types of arthritis: rheumatoid arthritis, osteoarthritis, and gouty arthritis, or also known as gout. So in this first section, we will be looking at osteoporosis. Osteoporosis is a major public health problem worldwide, and it is of particular significance in an aging society like Singapore. Osteoporosis literally means porous bone. As you can see from the picture, the left side shows a normal bone, whereas on the right side you can see a bone that's affected by osteoporosis, and you can see that there's a lot more empty space, or the bone is much more porous compared to a normal bone. So this makes osteoporotic bones abnormally fragile and very susceptible to fracture. Osteoporosis can develop as a primary disorder or secondarily due to some other factor. Primary osteoporosis is much more common, and it is due to age-related loss of bone from the skeleton. There are two types of primary osteoporosis. Firstly, postmenopausal osteoporosis, which affects women within 15 to 20 years of menopause. If we think about menopause, that's around 50 years old, so this affects women who are around 65 to 70 years old. The second type is age-associated or senile osteoporosis, and this occurs in both men or women above 70 years old. Osteoporosis can also be caused by other underlying diseases and conditions, so this is called secondary osteoporosis. And some examples would be hormonal imbalance like Cushing's syndrome. In our previous chapter, we saw that osteoporosis is one of the symptoms of Cushing's syndrome. Some blood cancers like multiple myeloma can also cause osteoporosis. And certain gastrointestinal disorders, for example inflammatory bowel disease, can cause malabsorption of nutrients like calcium and vitamin D, and this causes weakening of the bones as well. There are quite a number of risk factors for osteoporosis. Here are some that are not modifiable: increasing age, female, postmenopausal, ethnicity, so whites and Asians tend to get osteoporosis more often, having a small body frame, and family history. Some risk factors are modifiable, such as low calcium intake, vitamin D deficiency, sedentary lifestyle, cigarette smoking, excessive alcohol use, as well as the use of certain medications, for example corticosteroids, heparin, and anticonvulsants. Osteoporosis is a silent disease, and it is often asymptomatic in early stages. Some people do experience some signs or symptoms, for example loss in height. This is due to compression of the vertebrae. Kyphosis is the bending of the spine. You can see this in the diagram. And this bending of the spine is also caused by compression of the vertebrae. Some may experience backache, and this is due to the compressed vertebrae pressing on the nerves and causing pain. However, most people find out that they have osteoporosis only once they have a fracture, even with little or no trauma. Sometimes even a very vigorous cough or sneeze can cause a fracture. But of course, most fractures are caused by falling down, and most fractures take place in the spine, wrist, and the hip. Osteoporosis can be detected using the measurement of bone mineral density, and this is done using the DEXA scan, which stands for Dual Energy X-ray Absorptiometry. The photo shows someone who is doing a DEXA scan. There is an X-ray source below the table and a detection arm above. By measuring the amount of X-rays that can pass through the bone density can be determined. So if a bone is more dense, then less X-rays can pass through. Whereas if the bone is more porous, then of course more X-rays can pass through. The results of this scan will be in the form of a T-score. T-score indicates how dense the bone is compared to that of a healthy young adult. So a T-score of negative 2.5 or less will indicate osteoporosis. And this means that the bone mineral density has a value of 2.5 standard deviations or more below that of a healthy young adult's normal value. Before we look on the pathophysiology, let's just do a quick recap on bone physiology. In the bone, there are 4 types of bone cells: osteoclasts, osteoblasts, osteocytes, and osteoprogenitor cells, which are not shown in this diagram. The 2 important types of cells that we are looking at are osteoclasts. These are the ones that resorb or break down bone. And the other one is osteoblasts, which are responsible for forming new bone. Under physiologic conditions, bone formation and resorption are in balance. There is continuous formation of new bone and also breakdown of old bone. Let's look at what happens in postmenopausal osteoporosis. When a woman reaches menopause, the ovaries stop producing estrogen, and in the absence of estrogen, osteoclast activity actually increases. So this means there is more breakdown of the bone. So bone resorption occurs faster than bone formation, and there is a net bone loss. Now let's look at osteoporosis associated with aging. As we age, the amount of osteoblasts will decrease, so there's a progressive decline of osteoblasts in proportion to the demand, and therefore bone formation can no longer keep pace with bone resorption, and this results in a net bone loss as well. There are some steps that can be taken to prevent osteoporosis or fractures. We know that calcium is very important for bone health, and vitamin D is required for the absorption of calcium. So increase the dietary calcium and vitamin D. Weight-bearing exercises will help to increase bone density, and weight-bearing exercises would be things like yoga, tai chi, running, jogging, playing tennis, basically anything that requires you to be on your feet or supporting your own body weight, that will be a weight-bearing exercise. Swimming is not a weight-bearing exercise because you're not supporting your own body weight. Of course, swimming is good for other things like for cardiovascular health, but it is just not so useful when it comes to preventing osteoporosis. There are some things that can be avoided, like excessive caffeine, alcohol, and smoking. For those above 50 years old, it's good to do a bone density screening so that any osteoporosis can be detected early. And for those who already have osteoporosis, some safety measures can be done to prevent falls. For example, installing handrails so that a person can grab onto them, or just something as simple as removing clutter around the house so that the person doesn't trip and fall over it. There are also some medications available to improve bone density, for example, bisphosphonates, estrogen receptor modulators, as well as calcitonin. Now let's end off with a story that was featured on Straits Times Health section. This is Madam Tan's story. Madam Tan Simoy, 67, who has been on medication for osteoporosis for the past 3 years, fell when getting off her bed last July and broke 2 of her vertebrae. She needed 3 months of rehabilitation. She suffered weeks of pain and now takes calcium and exercises regularly to try to preserve her bone mass. So, some easy questions. Why did Madam Tan fracture her spine? I think you would probably say that she fell when getting off her bed last July and therefore she broke 2 of her vertebrae. Now let's think about how high her bed is. Most beds would probably be somewhere around your knee height. And for normal people who have healthy bones, this fall from such a low height would usually not cause a fracture. But for someone with osteoporosis, it is very easy to get a fracture even from such a minor fall. Next question, what are some risk factors for osteoporosis? So try to recall what you've learned. Look at Madam Tan, what risk factors might she have? And think of other possible risk factors that maybe are not listed in this story. Finally, what lifestyle changes should Madam Tan make? Here it says that Madam Tan now takes calcium and exercises regularly. So these are good lifestyle changes, and do try to think back of more changes that she can make to help with her bone health and also help to prevent fractures. That's all for our lecture on osteoporosis, and these are some resources that are quite interesting and you may want to watch them to supplement your knowledge on osteoporosis.